What's something you're proud of? Growing up in Oklahoma City, one of my proudest moments began after one of our darkest days. During a brief reading period in elementary school, our silence was broken by a loud boom. You know the story. An explosion went off just a couple miles from my school at the Alfred P. Murrah building. It was one of the most horrific terrorist attacks on American soil. But our response, our community's response, was awe-inspiring. I saw a community that valued neighbors. People were incredibly generous as churches overflowed with donations, and other faith communities too. The city understood its responsibility of taking care of all residents, and pioneers developed systems in response to the mass casualty, and those same systems then were the model for the response to 9/11. The United States looked to our city as a model of how recovery can happen. Oklahoma City took one of its darkest days and turned itself into a shining beacon of hope. I am so proud of the city I witnessed then. Our city led with generosity. Now, the years following the Oklahoma City bombing, the city changed dramatically. I saw the city become richer, and a renaissance unfolded in front of my eyes. In fact, now you might say that Oklahoma City is a millennial paradise with some of the best restaurants in the country, a low cost of living, a new NBA team, and fancy new skyscrapers. But the sad irony is that while all of this was happening, we as a people were getting sicker. In fact, our life expectancy in Oklahoma was average for the United States in 1990. Now, in 2018, we rank 44th in the country for premature death. This just did not align with what I was seeing in the city. So, as a nerdy public health practitioner, I had to know more. I dove into the data. And what I found is that it wasn't just life expectancy. It was pretty much all health outcomes that I could find. Naturally, as any investigator would do, I had to know where people were getting sick. And I have to be very clear that this is not just me asking these questions. Lots of people around the world have been asking these questions. And so in order to illustrate my own exploration, but also a much, much larger body of work, I'd like to show you some maps. So now this first map is of Oklahoma City. And if we overlay life expectancy rates on this map, we see that in the darker areas, people are living shorter lives, it's estimated. In the lighter areas, they're living longer lives. And for all of the maps that I'm going to show you, at least for this first part, the darker area is the worst health outcome. Now, this next map estimates physical activity. And what we see here is that in the darker areas, people are less likely to meet physical activity recommendations. And this next map is for coronary heart disease. And again, we see the similar trend in the east and the south. The darker areas are where people are sicker. And then again, we see with adults living with asthma, again, this south and east. And obesity as well, it's south and east. And I could go on and on with these. It's certain places, it's certain groups who are experiencing this health crisis at much higher rates. People are suffering right in front of our eyes. Now, growing up in Oklahoma, my father always used to tell me that Oklahoma is a friendly place. You can show up on someone's doorstep and they'll let you in. And I believe that to be true. But this data, it doesn't show that. So naturally, putting my public health hat back on, we in public health know that so much of our health is determined by things outside of the doctor's office. Things like how much money you make or how much education you've had have a tremendous impact on whether or not you're likely to live a long, healthy life. So let's explore some of those things as well. Now, this first map is for area median income. And what we see, again, is that in the darker areas, people are making less money on average. And income is not only important to look at for people who are making the money, but children who grow up in low-income households are likely to experience health implications throughout their life. And related to income, transportation. Here we see households that don't have access to a car. And this is an important measure to look at in a place where we are heavily car dependent. So just imagine with me that you're a single parent, you don't have a car, and you have to travel across town for work. How many buses would you have to take? How much stress would you experience on a daily basis just to get to work on time? What about picking your kid up from school? So now that leads me to education. And here we see a similar trend in the South. And education is connected to so many health outcomes. The list just goes on and on. And so here we're seeing where adults are living without having graduated high school. And this next map, when people are sick, we want them to have health insurance. So this map shows where people are living without health insurance. And again, we see in the South, and the trend is so apparent. And not only is health insurance crippling if you don't have it and you're hit with a medical bill, this has very real implications for our regional economy. And again, I could go on and on with these. Things that promote health are in one part of our city, while things that don't promote health are in another. Things like quality homes or food access or waste transfer locations, the list goes on and on. And so thinking about this, it makes me wonder, when did this start? When did it start that so much of our health and the opportunity to be healthy was so place-specific? I ask because my family came to this place for opportunity. My great-great-grandparents, they schlepped their families across the country to come to Oklahoma for opportunity and cheap or free land in one of the land runs. But I know, at least through my own lived experience, that not everyone has shared the same opportunities. So I want to take a break here for a second and just remind everybody that history can be pretty ugly. In fact, Oklahoma's history, like most places in the world, I didn't have to look very far back to find maps of our city that mirrored these. In fact, from the beginning of cities being designed, they were intentionally designed with a systematic hierarchy. Cities were built like this. And throughout the 20th century, people were intentionally segregating cities. The Jim Crow era clearly was checkered with cities and states and smaller communities making laws and regulations to limit people's abilities to access things. And Oklahoma City was not immune. In the 1930s, Oklahoma City's overtly racist housing ordinance was struck down by the Supreme Court as unconstitutional. But across the nation and in our city, people were not done yet. A more insidious form of segregation called redlining was born. Redlining is a discriminatory practice by which banks, insurance companies, and others limit or restrict mortgages, loans, and insurance for specific geographic areas. The most ubiquitous and overt form of redlining was the federal policy of underwriting loans. Now, the feds would draw up maps of cities across the country, and they would mark on that map areas of high value and low value. To give you an example, here is one of Oklahoma City's maps. Now, the manual used to describe how to make the maps was explicit that the map makers identify areas where, quote unquote, inharmonious racial groups were living. And they were supposed to mark on the maps that area to be named red or hazardous for investment. To show this map and the color gradient a little clearer, I'm zooming in and showing you a digitized version. The yellow and red indicate areas of low value, or where people of color were living, and the blue and green were of high value. Does this look familiar? East, south. Now, redlining was outlawed in 1968 with the Fair Housing Act, but the impacts are still felt today. Redlining allowed predominantly white communities and white families to accumulate wealth from one generation to the next. Grandparents, say, or parents would buy a house, and they would maybe borrow against that house to purchase something else, or even just send their kids to college. And then they'd be able to pass down an inheritance when they passed on. And redlining even restricted people of color from accessing things like the GI Bill and other federal programs that were so critical for so many Americans to become homeowners after World War II. To make matters worse, the value of homes is tied to property taxes, and property taxes fund schools. So the better the funded school district, the higher the value the home. People of color did not share the same opportunities. Now I'm going to take a minute and just ask, do you see anything wrong with this? Are you okay with this? If you're anything like me, you're not all right with the situation, but you don't know where to start. And as Albert Einstein said, no problem can be solved using the same consciousness that created it. We have to see the world anew. So instead of downplaying how our shared history impacts our lives today, we need to address historical inequities head on. Being direct and intentional allows us to begin to unravel the tools necessary to foster health in our community. And that's because research shows that around the world, there is a divide between the wealth and the health of the rich and the poor. But the healthiest places, even for the wealthiest, are the places where the poorest folks are doing well. The basic premise behind this is that if the systems aren't functioning for everyone well, the systems aren't working. And if the systems aren't working for some of us, they're broken for all of us. Now, if we just continue onward and we ignore this, we will continue to perpetuate inequities and ultimately hurt people. And that is not because of any negative rationale. It is because despite our best intentions, or even the best intentions of our community decision makers, Our policies, systems, and environments may have unintended negative impacts simply because of the foundation that they're built on. Now, key to identifying negative unintended impacts is diversifying who is able to influence decisions that impact us all. Critical thought is key. And if people making the decisions are all of the same race, ethnicity, gender, socioeconomic background, they've all come from the same religious group, they all have the same ability status, we won't get sufficient examination of our policies, systems, and environments before they turn into unintended impacts, or even after. So I have to say that it brings me tremendous hope, though, to see more and more women and people of color assuming leadership positions in Oklahoma City, Oklahoma, and frankly, across the country. I firmly believe, from the bottom of my heart, that if we approach this health crisis with the same spirit that responded to the Oklahoma City bombing, we have an opportunity to remake Oklahoma City's maps into the blueprint of how the United States can be healthier. Thank you.